Hi, I'm Dr. Jessie. I'm an integrative doctor of physical therapy at Resonant Frequency Medicine, and this is a brief video on clamshells and mermaids. For this exercise, you'll be in side lying. You might want a pillow or something that makes it more comfortable to be on your side. I'm just using my arm, and some people like to be right up against a wall in order to ensure that you're doing this exercise appropriately. So for here, you're going to bend your knees and bend your hips. You're not quite at 90 degrees each, but you're almost there. The feet are stacked, the knees are stacked. And you want to look down at your knees and make sure one knee isn't ahead of the other. If your knees are asymmetrical, it means your pelvis is misaligned and you're not going to gain the best benefit from this exercise. So knees are stacked, hips are stacked, and then place your top arm on your hip and gently elongate the side body. Okay, so basically we're bringing the hip and we're sending the hip just a little bit closer toward the feet. Flex the ankles and then take a breath in to relax and expand the belly, the pelvis. And as you breathe out, you're gently drawing the belly button toward the backbone and lifting the pelvic floor like you're stopping the flow of urine, not like you're doing it like your life depended on it, but you're just gently lifting the pelvic floor and engaging the lower transversus abdominis muscles that go across your pelvis. Then you breathe in through the chest, maintaining that engagement of the pelvic floor and the transversus muscles. And as you exhale, keeping this top hip elongating down toward the knees, exhale to lift the top knee. Inhale to lower slowly as you came up. Exhale to lift. And see how I am not trying to go into maximal range of motion. This is not a stretch, it's not a range of motion exercise. It's a very specific exercise trying to engage the gluteus medius muscles here. So if you go too far, you're just going into spinal rotation and using all the wrong muscles. So you're going to keep the movement kind of small and precise. Exhaling to lift your knee, inhaling to lower. And you're doing this 5 or 8 times, usually before you start to feel like a burning sensation, muscular activation, and maybe fatigue in the side of the hip. Maybe you get to 10, maybe you get to 15. It doesn't matter how many you do, it matters that you're doing it correctly. So you do as many as you can until you fatigue out. You rest, and then the mermaid version is the same thing, except we're keeping the knees stacked and together, keeping that elongation of the side of the waist, and you're just lifting on the exhale the top foot off of the bottom foot. Inhale to return down, exhale to lift the top foot, keeping the feet flexed, ankles flexed, moving slowly with your breath. And then after 5 to 10 of those, you can rest, and then maybe go back to your clamshells. So the most common error that people commit while practicing this exercise is they begin to rotate back when they're lifting the leg, especially for the clamshell. So you don't want to rotate back. Some people can align yourself up next to a wall so that you know that you've got that biofeedback of the wall. If your body touches the wall, you know you're rotating instead of purely using the gluteus medius muscles for this exercise. Another mistake people make in this exercise is they actually do like a hip hike, or they don't keep the side of the body, the top side of the body, elongated long enough. And when you do that, you compensate with other different muscles that are not supporting the optimal movement. So make sure that before you start, you're aligned against a wall, or you just know that your hips are stacked and your knees are stacked, and then you elongate the top of the side of the body before you do your exercise. And then one more extra credit that can be really helpful is a straight leg raise. So the top leg goes straight, and then you're going to send the top leg back a little bit so that you're in a tiny bit of extension. And same idea, get the top side body long, and then lead with the heel to lift up. If you're leading with the toe, you're going to strengthen the wrong muscles. So lead with the heel to focus on the side glute muscles. And slow motion is optimal.